Good morning and welcome to AirSage Brewing Data. My name is Robert Kohler, and I want to thank you for joining in to learn more about data today. A little bit about myself. I'm the CRO at AirSage and a professional transportation planner with 2 decades of experience in the transportation and big data spaces. Today, we're going to be covering some really interesting topics: transportation health equity and strategy, rural mobility opportunities, and innovation mobility. With that, I would like to introduce our guest for today, Valerie Lefler. Valerie is based in Lincoln, Nebraska, and is the founder and executive director at Feonix Mobility Rising. She's an international expert in rural transportation, accessibility, and mobility as a service. Her company launched programs in 9 states, with notable partners such as Toyota North America, the National Aging and Disability Transportation Center, Easterseals, AARP's Office of Driver Safety, and even Michigan Department of Transportation. Valerie was also featured by Smithsonian Magazine as one of the top 9 innovators to watch, and has been highlighted in the New York Times and NPR. With that, I'm very excited to introduce our guest today, Valerie Lefler. Hello and good morning,
Welcome.
Valerie.
Thank you so much for the opportunity to be here, Robert.
Hey, it's great seeing you here, but we have a lot to chat about today. So how about we jump right in?
Sure, let's do it.
Great. Well, our first topic is going to be transportation, health, equity, and strategy. So I think it's really important that we actually understand better what is an underserved community, and can you give some examples?
Sure, absolutely. So underserved communities can be looked at in two frames, basically. One, geography, and another could be, for example, individuals with disabilities, older adults, communities of persistent poverty. And so let me give you 2 examples. So, for example, in Nueces County, Texas, it's right outside, or the county right outside of Corpus Christi. And there are areas in the county that are known as colonias. These are communities that many of them don't have actual road infrastructure. They don't have proper sewage, pipelines, things of that nature. And in some of those communities, they even have contaminated arsenic in their water. And so these are communities that have extremely high rates of cancer diagnoses, other kind of illnesses, and they do not have access to transportation. So you can't drink the water coming out of the faucet, but you can't get there to also get water from the grocery store. So that's a really extreme example of a highly underserved community in the United States. Another example is Holmes County, Mississippi. Median household income is $22,000. Roughly 40% of the population is currently experiencing some level of food insecurity. And there's just a high number of challenges relative to access to healthcare. There's 17,000 people in the county, and there's only 2 grocery stores. And so when it comes to access to healthy food, things of that nature, there's huge food deserts as well as mobility deserts. So those are 2 kind of frames, both from a geographical frame, but also underserved communities like individuals with disabilities, whether you're living in a very wealthy community or a very community that has a lot of challenges with infrastructure. Even in that situation, many times individuals with disabilities or older adults or communities of color do not have the same opportunities that others do.
Wow, that's quite interesting to hear all of those things, even in the States. I was unaware of challenges like that. So I guess to follow up on that with regard to transportation, how do transportation systems impact equity, especially in these underserved communities?
Yeah, I think, one of the things that we talk about a lot at Feonix is access to social determinants of health. And so that's the ability to get to the doctor, your housing situation, your ability to get to a good job, your access to education, your access to social services. And so in an underserved community, or many times we talk about it as underfunded community, if you can't get to a good paying job, or you can't get to urgent care clinic without a 3-day wait period, it's going to create some major disparities. One of the things that I talked about last week in one of my blog articles is, the zip code factor, and that your zip code is one of your greatest determinants of your life expectancy, not your age, not your income, not your education, but where you live. And so if you're living in an underserved community and you can't get to proper care, you can't get to healthy food, you can't get to jobs that pay a living wage, you're in basically a walled garden of opportunity. And so you can't escape the situation that you're in because you can't get to the resources you need to overcome that challenge. So, for example, let me give you a breakdown or a story, if you will. So in Holmes County, Mississippi, there was a young woman who was trying to get her GED. And to do that, she needed to take her daughter, who was 3 years old, to a daycare. The public transit in that community have funding, but they can't find a lot of matching funds. So the rates for public transit in this rural community is $20 a ride for this particular mother. And so she would have had to pay several $100s a week in public transportation to get to her GED classes and to get her daughter to preschool. She's living on $1,100 a month. So she can either pay rent and get groceries, or she can go to school and maybe pay rent. And so then there, something has to give. And so in a community where you have a mother who's trying to, make sure her daughter can get to preschool, make sure she can get to her classes to get a better job, she cannot get out of the system, if you will, of this challenge because she can't get there. And so I think a lot of times these things are hidden in plain sight, if you will, and they present themselves in really, kind of alarming ways when we think about in 2022, we're sending people to the moon and we're sending people into outer space on joyrides, but single mothers can't get to educational classes and refugees can't get to jobs.
Yeah.
I get really passionate about stuff.
It sounds like a circular reference in Excel. You're going to perpetuate the cycle if we don't have a solution to improve these lives, because then the child is going to grow up in exactly the same situation when she is of the same age and having a family.
Right. Well, and that's why, there's especially this focus on communities of persistent poverty right now. The USDOT had a set of projects that they funded about a year ago called the FTA Hope Project, which is helping obtain prosperity for everyone. And in particular, it was looking at studies of communities of persistent poverty. And there's actually like a formal definition. And these are communities where 20% or more of the population have lived at or below poverty levels for the federal poverty line for 30 years. So, there is systemic breakdowns in these communities. And so how do we break that cycle? And so, we have the opportunity to work in the city of Detroit on one of these incredible projects. And we were talking with a community leader that works for a community culture center. And she was sharing that, there are jobs nearby that make $16 an hour, but there are jobs 10 miles away that make $26 an hour. But in order to get to that job 10 miles away, that's 3 connections on a bus in 2.5 hours. And that's not if you have to drop somebody off for daycare. And so there's some really sophisticated, but yet very simple barriers that are preventing many community members that are living in these zip codes from actually prospering. And so how do we work together to break that down? And that's what Feonix is all about.
Yeah, and that's a great way to kind of segue into our next question regarding barriers and things like that are unfortunately very prevalent. What considerations should governments take regarding transportation equity, both on a short-term and a long-term basis?
I think from a short-term basis, and a long-term basis, number one, the stakeholders and the community has to be involved in the policy design. We work with an Ann Arbor Center for Independent Living, and one of the things that Will Purves always has first shared with me is he said one of their main core values is nothing about us without us. And so how do we make sure that when we're designing these frames, that the community is actively engaged, in making sure that they have feedback into how it's designed. But I think the other thing that we see over and over again is that the funding mechanisms are often broken. So for example, let's talk about Holmes County, Mississippi again. This is a community, persistent poverty. There's not a lot of jobs. There's not a lot of, excuse me, property tax revenue. There's not a lot of sales tax revenue. Excuse me. So when that rural public transit system goes to find matching funds, which is required by the funding mechanism, where's that going to come from? There's no magic wand. The community needs mobility, but there's no money within the community to provide that match. And so that's one issue where in a community of persistent poverty, coming up with the same percentage of match as a community that has a median household income of 80,000 is two completely different scenarios. And so again, you're creating these walled gardens. The other component is that the burden of filling out the paperwork in order to access this. A lot of these rural communities do not have grant writers. They do not have huge staffs of administrative folks who can navigate some of the paperwork that's required. And so many times the communities that the very funding is designed to be handed to can't access it because the application process is so onerous. And so I think there's some of those are the things that we see present themselves over and over again.
Yeah, it seems there are a lot of challenges, but I'm trying to be optimistic and say there's a lot of opportunities for all of us to work together to improve this. So how important is it for planners, engineers, and other people in the industry to evaluate equity impacts in their transportation impact analyses?
I think it's absolutely essential. I mean, we really need to think about when we're building our communities and the infrastructure of our society, we want everyone to succeed, correct? Right?
Absolutely. What is it? A rising ship rises everybody?
Absolutely. Absolutely. Or high tide rises all boats, right?
That would be it. Exactly.
So, one of the most profound kind of educational experiences, I was talking to an engineer who was at the Georgia Tech School engineering program, and he was talking about one of the programs that they have for their community regional planners, one of their senior capstone programs, is for the student to spend a day with an individual with a disability and then to understand what that experience is like. And so many times, if you've ever navigated your city in a wheelchair, or you've ever navigated your city, not being able to see, that really changes your perspective of how many users experience our communities. And so I think that is such an essential part of planners and engineers, is to engage centers for independent living, to engage lighthouse centers, to engage the area agencies on aging. And so many times when you're designing for accessibility, you're truly designing for all this universal access. And so I feel like, that is such a pivotal part in building an equitable society. We have a project with the Federal Transit Administration and the FTA on innovation in access to care. And we're looking at solving first and last mile barriers, right? So there's a public transit. And when we first started this grant, our hypothesis was, if we can get somebody to the bus stop, from where their home is at, whether that be half a mile or 10 miles, they can ride that fixed route into town and be able to get to their doctor's appointment. But most of the folks that we're supporting that are referred to us by social workers are not able to navigate the public transit, because so many times in between stops, even just from the bus stop in front of the nearest hospital to the front door of the facility, there's not even a sidewalk. And so if I'm in a walker and I've got to go up a hill, in the grass for 2 blocks to get to the nearest bus stop, there's a challenge. And so we looked at 25 bus stops, and of those 25 bus stops, only a third of them had a curb cut. So, and we're not talking about like residential, kind of stake in the ground, get to it. We're talking in front of one of the top 3 most frequented hospital in one of these communities. And so we have to do a better job when we're planning these public transit stops in our communities to make sure that they're accessible.
Absolutely. And I've worked on a couple of hospitals, when I was a consultant, and each time we were fortunate that the bus actually pulled into the hospital or medical
Wow.
campus and not only stopped at the hospital, but multiple parts of the hospital, because you have different entryways for different departments. And then if you have medical office buildings adjacent to them, these are the types of things where we need to make sure, even if it's a little bit of a delay for the entire population on the bus,
Yep.
having that additional stop helps out and provides easier access to those who need it. Um,
Absolutely.
you
Absolutely.
know,
And that's having the public transit agency at the table in the planning.
yeah, and I think that's integral, because it's kind of the whole ability for stakeholders, the riders and the transit agency need to be represented and heard to understand what can we do to improve. And that you've already touched upon a bunch of it, but I had another question here. How can transportation equity be improved in an underserved community? I'm sure you could go on about this all day. Do you have any additional thoughts on that?
Yeah, I think, well, in a lot of underserved communities, there is none. So some would be great. There's 40% of the counties in the United States have limited or no access to any type of public transportation. But the other thing I think that we see is that on-demand access is so important, and making sure that if I'm that older adult and I'm waking up that morning and I've got a splitting headache or my chest hurts, I can get into a doctor that day. Or if I am in a situation, I have a job interview, I can get there on time. And so I think that a lot of times we're not asking in underserved communities for the moon, we're asking for a ride.
Yeah. And when we begin at that level, we can significantly improve, because it's so much easier with the littlest effort to actually make a big impact. So each of these additional pieces we put together can really uplift that entire community. And I think that's what's really integral here. On
Absolutely.
projects when there was a significant impact into a community, what level of public involvement occurred with that community?
Yeah, I think I'm thinking about a lot of the different programs that we've had. One of the things that we always do within Feonix is we have what we call these mobility leadership circles. And these are major stakeholders that come to the table that provide input in the design of the solution and the maintenance of the program. And I think one of the most transformative programs that we've been able to support is in Dallas, Texas. So we work in very urban communities, but we also work in rural communities. And with the AARP Ride at 50 Plus program, where we're a collaborator in deploying the mobility as a service ecosystem, we've been able to see so many different gaps being filled, and everybody is at the table. We've got stakeholders from the supporting individuals who are homeless. We've got individuals at the stakeholders supporting seniors. We've got individuals at the table who are presenting equity with the LGBT community. We've got city council members. We have the public transit agencies. We have the taxi companies. And everybody comes together because they want everybody to be successful. And I think when the community is involved in the beginning and really providing the feedback of where the barriers are, and what the challenges they have are, then you can be responsive. Versus so many times in this industry, we see this over and over again, where we have a really cool tool and we deploy it, but the community is like we'll bring them along afterwards. And you have to bring them along from the very beginning, and they need to be involved in the design of the solution.
Yeah, public involvement is quite critical. As I add into the next question, I want to give you a second to make sure the listeners that might not have visual in front of them know how Feonix is spelled, just in case they want to check out your company.
Yeah, it's Feonix, FEONIX.org.
Perfect, thanks. I wanted to make sure if somebody was trying to Google it or search it out that they weren't typing in Feonix with a PH.
No
but
worries.
Moving on to rural mobility and opportunities. So Feonix aims to provide reliable and affordable transportation by developing and connecting services in vulnerable and underserved communities, as we've talked about. How have some of your projects improved the lives of people in rural areas?
I think, getting access to social determinants of health. We have a really incredible project with the National Community Care Corps in the coastal bend of Texas, which involves also supporting Nueces County. And we provide volunteer drivers as well as non-emergency medical transportation for individuals who do not have other resources. Our partners are federally qualified health systems, the Area Agency on Aging, the Center for Independent Living, and they say, we don't have a program to help this person. Can you at Feonix find a solution for them? And many, many times, these are individuals in very rural communities, 75, 100, 150 miles from the nearest doctor. And so one example of a trip that was very kind of health related, if you will, was a gentleman in a rural community had been waiting, I'm not joking, 2 years to be able to get a ride into town to the doctor on the day that the free clinic was open. He didn't have a wife, he didn't have kids in the area, he wasn't going to be a burden, and he was in excruciating pain, and he literally just could not get there on the Saturday that they had the free clinic. And so being able to provide rides to just dental care is something as basic as that, or helping an individual. We support an individual the other day who suffered severe anxiety, and she had a disability, and she said, I've been since COVID in my house. The only thing I've left my house for is the doctor appointment. And we took her to the beach for the first time. And for her, that was literally soul filling. And I think in some cases, if we can help improve individuals or reduce isolation, we can improve mental health without other therapies or treatments involved. And so I think that making sure that we can get folks out of the house, I think we all felt that during COVID, very literally. But some folks have really been feeling that, and to be able to fill both those needs was just really cool.
Yeah, absolutely. And I'm hopeful that technology and social media has made it even easier and more helpful for you to find volunteers and people that want to help bridge the gap, because I think there's a lot that everybody can do, and there's definitely a good number of people out there looking to help out. They just need to find out about these abilities where they can help out. And so there is a lot of innovation and mobility too, to that end. So what are some of the most promising innovations and smart initiatives in new mobility and TOD that you're aware of?
Yeah, I really think the mobility as a system or mobility as a service ecosystem is truly the best way, or the one of the shining stars that's coming forward, because it's looking at the community and it's looking at the transportation not as a mode but as a service, as an ecosystem. And as we connect all of our transportation providers together, we have the opportunity to provide a supportive structure where we can subsidize these transportation. I think LA just launched a multi-million-dollar pilot on providing mobility wallets for individuals in underserved communities. I mean, we subsidize and provide food for people. We support housing. We support daycare. We need to bring also transportation to the equation, because even if they have food, even if they have daycare, even if they have housing, if they cannot get to the jobs, what we need to make sure we can break that cycle as well. So these mobility wallets that are the future within mobility as a service is going to be a pivotal ecosystem booster or society support. And I'm thrilled to see the research that's going to come out of that pilot in LA.
Yeah, that's great. And definitely a lot of things we can continue to evolve in the industry. I mean, it's taken such a base form in the past 10 years, maybe. I'm really excited to see where it's going to be in another 5 to 10 years from now. I take Uber and Lyft all the time as I travel for work, and sometimes they're competitively priced, even among the transit offering. So it's a very difficult choice to make. Do I take the transit or a TNC? Right. So do you see TNCs as a threat or a supplement to transit providers?
I see them as a supplement. I mean, the sustainability of how TNCs are evolving, joining forces with the taxis in New York City and, kind of beginning to creep onto the various platforms within transit. I think that it's definitely a supplement because, in a lot of the communities that we serve, they can't afford the taxi or there is no taxi. And so it is the best option. And so a lot of times those drivers are also unbelievable, incredible humans that are able to share life experiences with the passenger that, brighten their day or whatever. So I'll be hard pressed to say there's a bad type of transportation or there's a threat. It's definitely an ecosystem challenge with regard to the pricing, but it definitely drives innovation, and it drives us forward. And I think competition is a good way to make sure that we're on our toes and we're creating an ecosystem of mobility that moves us all forward.
Yeah. And, as a society, we take millions, hundreds of millions, if not billions of trips per day in aggregate. What I do, working with a lot of the origin destination trip data, is understand in different communities and even microcosms of those communities, how do those trips vary? So how do you think planners can leverage location data to help them plan and build better active transportation networks, which are a comprehensive network?
I think that a lot of it is looking at the population density and the community characteristics relative to the travel that's used. So for an example, in a lot of rural communities, there are a number of members who are on Medicaid transportation. And with that transportation, you have to call in 3 days in advance and you get a ride. It's a very expensive ride for a Medicaid transportation provider to provide. Sometimes those rides are $300-$400. And what we will see in rural communities is those rides are getting canceled on a frequent basis. And what happens in that is then people don't trust it and they stop taking it. And that same could be said for transit ridership or Uber and Lyft, but to say, if we can look at those origin and destinations and we see communities that have low household incomes or communities of color or the community geographics, whatnot, does that ridership square up with the population density? And if we see that, or we see disparities, why? And addressing that matter. So I think that, the social economic status or data or race and ethnicity data, really looking at that ridership would also be an incredible component of making sure that you're building an equitable mobility ecosystem.
Yeah, this has been very informative. And unfortunately, we're just about out of time. But I want to say thank you very much for joining us on the show today, Valerie.
Thank you, Robert, for having me.
Yeah, it's been an excellent time learning more, learned a lot today, but I'm hopeful that our listeners and viewers also did the same. But before we leave, I want to say that I hope you can join us next week when we have Gallo Bowen on the show. Gallo is an Ecuadorian American author, a licensed professional engineer, and a technological evangelist. He's the vice chair of the American Society of Civil Engineers Technical Committee on Mobility on Demand and as a Service. He authored Mobility 2040, Exploring the Emerging Trends Radically Transforming Transportation Systems in the U.S., which was released back in April of 2021. With that, I wish you all a great day and weekend. Come join us for AirSage's Brewing Data next Friday.